Kevin Barrett. I'm one of the vascular neurologists at Mayo Clinic in Florida, and I'm here today to just share with you a bit about what we know about stroke. And stroke is a common problem in the United States. The most recent estimates actually suggest that up to 800,000 people each year have a stroke, either a new stroke or a recurrent stroke each year. Stroke really comes in two different types. The most common type is ischemic stroke, and that occurs in about 85% of individuals with stroke. And the other general category of stroke is a hemorrhagic stroke, which accounts for the other 15%. Ischemic stroke occurs when there's an interruption of blood flow to a specific area of the brain, and the symptoms depend upon which part of the brain and which blood vessel is affected. And a hemorrhagic stroke occurs when one of the blood vessels either leaks or ruptures, leading to bleeding into the brain itself. Stroke symptoms can be varied, and this is what makes diagnosis and recognition difficult. But common stroke symptoms, those symptoms that should prompt one or a family member to call 911, would include the following: sudden loss of vision in one or both eyes, sudden inability to speak or understand what others are saying to you, sudden loss of strength on one side of the body, particularly involving the face, arm, or leg, sudden difficulty with feeling on one side of the body, or a sudden difficulty with one's ability to walk. The common theme is that of abrupt or sudden onset, as stroke is a vascular event and there's often no warning. Stroke treatment is effective the earlier it is administered. So from the moment the symptoms start, the clock is ticking. The treatments that we have for stroke, and many of them are effective, need to be administered as soon as possible after the symptom onset. So this is why recognition of stroke symptoms, calling 911, and being evaluated in a primary or comprehensive stroke center is so important to effective treatment and good outcomes after stroke. Of the 800,000 strokes that occur in the United States each year, about a third are recurrent strokes. Once an individual has a stroke, their relative risk of a second or recurrent stroke does increase. So therefore, stroke is a risk factor for stroke. But one of the important things that we do is make sure that after somebody has had a stroke, that we identify the most likely cause for the stroke and also any of the so-called modifiable risk factors for stroke. And if we can aggressively treat those, then we could substantially reduce one's risk of a recurrent stroke. That being said, the absolute risk of having a recurrent stroke still remains low, in many cases less than 10%. So having a first stroke is certainly not a guarantee of a subsequent stroke, but it has to be taken seriously, and compared to the general population without stroke, those who have had one are at increased risk of a recurrent stroke. So age is the strongest independent risk factor for stroke. After the age of 55, the risk of stroke essentially doubles with each decade. However, people of any age can have stroke. So being young, in your 20s, 30s, or 40s, and being diagnosed with high blood pressure should be taken seriously, because high blood pressure is a risk factor for stroke, and we see a proportion of patients who do have strokes before the age of 55. So if during a routine physical with your care provider it's found that you have risk factors or you have a behavioral risk factor like smoking, that should be taken seriously even at early ages, because stroke is not unique to the elderly population.